I'll begin my exam by assessing the overall appearance of my patient's abdomen. I'll be looking for rashes, striae, ecchymosis, which I do not see. I'll also be assessing for visible pulsations, such as peristalsis or aortic pulsations, which I do not see. And then also her abdomen is symmetrical, no masses, flat, and no concerns that I can see from my visual. I will then move on to listening or auscultating to her abdomen. I will listen to each 4 quadrants. What I'm expecting to hear is 5 to 30 bowel sounds per minute. If it was more than that, that would be hyperactive. If it was less than that, it would be hypoactive. And in order to diagnose absent bowel sounds, I would need to listen to each quadrant for 5 minutes. But I will listen to each quadrant. My patient has normal bowel sounds. What I will now do is auscultate for bruits over the aorta and renal arteries. My patient has no bruise, which is the expected finding. Bruise would be abnormal. I will then I'll then move on to percuss the abdomen. What you should hear over the abdomen is general tympany. Dullness indicates you could be over a solid organ such as the spleen or the liver, or could be indicative of a mass. So I will percuss each quadrant. And I will also percuss her liver edge. I will hear dullness over the liver. When I hear tympany, that's when I know I've reached the liver's edge. And what I'm expecting is to have a liver span of 6 to 12 centimeters. And I heard tympany over the left upper quadrant. And if I heard dullness there, that could indicate splenomegaly. The next thing that I will do is now palpate the abdomen. I will begin with light palpation, assessing that my patient is comfortable and does not have any areas of pain, no guarding. I will then move on to a deeper palpation. Since my patient was comfortable with that, I'm assessing for masses or anything abnormal, which I do not feel. There is no no rebound tenderness when I remove my hands, no guarding, no rigidness, nothing abnormal that I'm feeling. I can also assess the patient's liver edge. I will support under the ribs here, and I'll ask the patient to take a deep breath in, and I will then kind of use my hands to hook under and feel for the liver's edge. Okay, and then you can also palpate for the spleen. I would do the same thing on the other side, support the ribs, and then also try and palpate the spleen, which is only palpable in 5% of patients. The other thing that I will palpate is the aorta. So I'll begin on a little bit over at the umbilicus, a little bit to the left, and palpate the edge of the aorta, and then the other side. What I'm expecting is to find a diameter less than 3 centimeters. A next test that I'll perform that can be indicative of appendicitis or inflammation is a psoas and occipital test. I will put my hand over her right knee and ask her to lift her leg and put a little resistance. Any pain with that?
No.
Pain with that could be indicative of an appendicitis or inflammation. Then we'll do the occipital, and I will internally rotate her hip. Any pain with that?
No.
Okay. So both of those tests were negative, which is a normal finding. And then finally, the last thing I'll do is have my patient sit up, and I will test for costovertebral angle tenderness, so inflammation or tenderness of the kidneys. And I will use the ball of my hand to tap on both sides of her back. Any pain with that?
No.
Okay. And that concludes my exam.